for cluster number 2 remains at 19. 9 are fully vaccinated, 2 have 1 dose, 5 are unvaccinated and 3 are not eligible to be vaccinated. There were no new positive cases in the Northern Territory overnight. This is good news, but it's not a day to get ahead of ourselves. We will not presume it means we have trapped the virus. This is Delta, it is in large vulnerable households, we're not out of the woods. The next day or two remain crucial. We are still waiting for a lot of tests to return from Robinson River and we're expecting to get those results this afternoon. There are close contacts yet to be tested or have their results returned. There are close contacts yet to be found and there will be more close contacts identified. There is also a strong chance of close contacts who have tested negative returning a positive test in coming days. The next few days remain crucial. We still have lots of testing and tracing work to do, but things are looking more positive. There is one new exposure site since yesterday's press conference that I want to highlight. That is the BP service station in Katherine on 13 November from 2:40 p.m. to 4 p.m. This is a close contact site. So if you're at the BP service station in Katherine on that date from 2:40 to 4 p.m, please call the COVID hotline and identify yourself as a close contact. You will need to isolate and get tested and remain isolated even after a negative test. It's a different date and time to the already announced casual contact site at the BP. As I always say, the situation is constantly changing. Please keep checking coronavirus.nt.gov.au around those exposure sites. Keep following the media. To contact tracing. There are now 384 close contacts who have been identified for cluster 2. 288 of these have been successfully contacted and are isolating. Of these, 201 have returned a negative test. I thank our contact tracing team. They work around the clock and every contact they locate and isolate is another potential chain of transmission broken. Investigations are ongoing for the McFarlane Primary School. The close contacts from that site is now identified as 38, 10 adults, 28 children. The tracing has identified individuals as close contacts rather than an exposure time window. Most of these close contacts have been contacted. We still have some work to do to contact the last 5. Onto a couple of important pieces of information I flagged yesterday. We still expected the genomic sequencing for cluster 2 back today, late afternoon probably, but maybe tomorrow that we'll receive that information. This will be extremely important as we'll confirm whether clusters 1 and 2 are linked. Our belief remains that they are most likely linked. Until we have this link, we cannot assume. Wastewater today came back positive for Katherine in all 3 catchments up to November 16, so that's and 15, so Monday and Tuesday. This is not unexpected. We know there was COVID in Katherine on these days. We're also doing wastewater testing in surrounding areas, including Barunga, Binjari, Beswick, Pine Creek and Kyebrook Farm. Wastewater for Darwin continues to be negative in all the right areas. Later today, probably early evening, we will get our first wastewater testing back for Alice Springs, Borroloola and Tennant Creek. While expected today, there's always that chance it comes in tomorrow. Yesterday, there were 2,113 tests processed by our labs in the 24 hours until midnight last night. No positives outside those we let you know about yesterday morning. Thank you to everyone who came forward for testing. As you always do, Territorians stepped up. Testing and vaccinating is our best weapon against this virus. These numbers are giving us increasing confidence about the situation. I know the Cho direction for anyone who left Katherine since the 7th or Robinson River since the 11th was a disrupted one that affected a lot of people. More people than perhaps we expected. There was a lot of movement. Thank you to everyone for complying. It shows how much movement there had been out of Katherine and why our territory-wide measures are important. The testing rules for this new direction depend on your vax status and if you are symptomatic. If you are fully vaxxed and have left Katherine since November 7 or Robinson River since the 11th, you must get a test within 3 days, but unless you have symptoms, you don't have to isolate. If you are unvaccinated or only 1 dose, isolate immediately and get a test and wait for a negative result. If you have been to an exposure site, if you are symptomatic, then the advice remains to isolate and get tested and wait for a negative result, and if you're close contact, remain isolating. We've now stood up the drive-through testing clinic at Marara in Darwin again to give people more options to get tested. Please keep coming forward if you have any symptoms and test. I keep saying it, but testing is our second best weapon behind the vaccine. 686 tests were done in Katherine yesterday. That's huge, thank you. At this stage, No negatives outside I've already outlined, but we still have 218 tests to be processed and we are waiting on the results of those. We've established a pop-up testing clinic at Eastside. We've also established a roving testing clinic. I want to touch on the vaccination rates in Katherine. The vaccination rate in Katherine yesterday was 71, and that is a concern. There may have been additional vaccinations through the mobile ARCHO teams. I don't have that data yet, but will not have been a huge number for the time it takes to do mobile vaccinations. I understand the issue may be a mobility one, and we are tasking the local team to provide options today for how we assist with logistics into our vac centre. I have also asked for on-the-ground advice on how vaccinations are going this morning, and I have seen a photo of a queue to our clinic. It may be that yesterday people were prioritising testing and that this will shift to vaccinations today. Vaccinations remain one of the 5 reasons to leave your home in a lockdown. If you have family or a mate who isn't vaccinated, encourage them to get their first dose today. We need to see a lift in the vaccination rate in Katherine and have confidence this is happening in vulnerable pockets to consider lockout as a decision. Lockdown remains the best option for Katherine at this stage. To Robinson River. Our rapid assessment team and the Robinson River community continue to work together at an amazing pace, and I thank them all. We promised we would test everyone in Robinson River within about 2 days, and we have achieved this. 173 PCR tests were performed in Robinson River yesterday. The whole of the community has been tested, and I understand it includes people from surrounding homelands, and I'm seeking confirmation on that. We are going out to 3 homelands today. We still need to get all of the results back to be sure that we have caught this cluster in Robinson River. We may need to do some more testing. That's why, like in Katherine, the Robinson River lockdown will remain in place until Monday 6 p.m. A total of 41 people have been evacuated from Robinson River to the Centre for National Resilience. That includes the 31 that I mentioned yesterday. A further 8 are being transported today, taking the total people transferred to the Centre for National Resilience from Robinson River to 49. The high vaccination rate of Robinson River has been crucial. We prepared for this, we have surged in. The community has been magnificent. Only 15 people remain to receive a first dose in Robinson River. And I understand they all want to be vaccinated today. In Borroloola, 153 tests have been done. 60 were done yesterday. I know 20 are negative. 27 vaccinations were administered yesterday. I'll briefly touch on support for businesses affected by the Katherine and Robinson River lockdowns. I know you are doing it tough. I thank all of you from the bottom of our heart again for the sacrifices you're making for the greater good of the Territory. You are heroes. Thank you. Our government is offering a 4th round of immediate one-off payments. As part of the Territory Business Lockdown payment, businesses who have had to cease trading or have suffered a revenue loss of 50% are eligible for an immediate payment of $1,000. Eligible small businesses are those who are actively trading with a turnover of $75,000 to $10 million and less than 20 full-time equivalent staff. The payment will help cover ongoing costs, provide support over the lockdown period. Applications close on November 26. Please visit businessrecovery.nt.gov.au for more information. In addition, the Commonwealth COVID-19 disaster payment is also now available for Territory workers impacted by the current locations. I thank the Australian Government, I thank Josh Frydenberg for this work. Territorians who lost at least 8 hours and less than 20 hours of work are eligible for a payment of $450. Territorians who lost 20 hours or more of work for the week are eligible for a $750 payment. Before I conclude, I want to give a really positive call out today to remote Central Australian communities. In the past 24 hours, 4 more Central Australian remote communities have been taken off the below 70% first dose vaccine list. They are all anti-health control communities: Wataka, Wallace Rockhole, Nirrupi and Ikunji. Where anti-health are responsible for vaccinations, the total number of communities across the Territory below 70% first dose is now 19, down from 25 a few days ago. We will get an update from the ARCHOs in the next 24 hours, so that number may be even less, and I understand the ARCHOs are also reporting a positive uptick in vaccinations. Thank you to everyone who's got the jab in our communities and right across the Territory. There were 2,444 vaccines administered in the Territory yesterday. That is the 3rd highest day for the Territory. That is big. Thank you to everyone who got vaccinated yesterday. Today is a positive day overall, and that is thanks to Territorians. You are lifting as you always do. You're vaccinating, you are testing. Keep vaccinating, please. Keep testing, please. You're looking after each other. You're doing everything we've asked. Thanks to you, we are in a better position today than we are yesterday. But this is not a time for complacency. We are not out of the woods. We cannot get ahead of ourselves. Confirming, we are waiting on important wastewater results, a crucial genomic result, more test results, more close contacts to be found and tested. There remains a huge amount of work to do. The best thing about no extra cases is the time it buys our tracing teams on the exposure sites and close contacts to date. It is a really important 24 hours that we've got now. Thank you, everyone. Your efforts give me hope that we can crush this.
Thank you, Chief Minister. So, as the Chief Minister has said, it's certainly a positive day. But as he has also said, we cannot be complacent. All of the known cases are from 3 households. I have to say it is unlikely that it is only contained in those households. I'm very pleased with the testing rates and delighted with vaccination rates. I think people clearly now understand that the best thing they can do is get vaccinated. Even if it's only your first vaccine dose, come forward and get that dose, please, and then come forward for your second dose. I want to also speak about the teams that have been working around the clock for the last few days, but also for many months now. I thank them sincerely. I met with them this morning. They're tired, but they are very proud of what they do and proud of what they have achieved. I thank the community too. I'd like to thank Katherine and Robinson River for adhering to the controls that we've had to put in place. We're not out of the woods, but if we continue to do what we're doing and what you have done up to now, there is some chance we'll come through this with a number of positives. One, higher vaccination rates that will protect us all. And 2, we will have learned to work together to conquer this virus. We are going to be, I'm afraid, as you all know and expect, in the next few weeks and months, we're going to be faced with this again. And it will come to an end, the actions that we've had to take will come to an end when we achieve those vaccination rates. Thank you.
Good morning, everyone. To Robinson River, we're mobilising out there again today to provide some care packages to the remaining residents. We're also actioning our animal welfare group. Obviously, there's been a fair chunk of the population that we've had to move into the Centre for National Resilience. We want to make sure that their homes and in particularly their animals and pets are being supported. So there's a lot of work going on in the ground. There's visits out to some of the homelands today as well for vaccinations. Lots of things going on, those people out on the ground. The relationship with the community already is fantastic. The compliance is a real credit to the population of Robinson River. And equally, we're here within Borroloola. It's pretty well at peace there at the moment, and the community is actively listening and engaged with any directions that are forthcoming. So I pass on my appreciation to you as well. In Katherine, similarly, we've had a pretty good run. We only had 1 infringement notice yesterday for some aberrant behaviour with an individual. Again, unfortunately, the infringement needed to be issued to ensure that compliance was ultimately undertaken, but overall the compliance has been pretty good. The vaccination numbers, we understand, were a bit low yesterday. We've had some anecdotal feedback that transport was some of a problem. So the incident management team based in Katherine has been tasked with trying to pick up that issue and have that resolved very quickly. The testing clinic, we've added an additional lane for the high school, so that processing should also be quick. I know there's delays there this morning, but again, please understand that it's important that you get tested, so stay on the line, and if you are heading there, just take adequate supplies so you can stay in your vehicle and be suitably looked after. Again, more generally, compliance in Katherine is going very well, and I'd like to pass on my thanks to that. In respect of the welfare group, they've been actively engaged with the Katherine Welfare Group. That includes a number of not-for-profit, Salvation Army and others. Salvation Army have engaged with some 51 people over 13 disparate locations who are sleeping rough. All have been actively engaged. Care packages are being provided. We've now got the Contour Hotel in Katherine set aside 50 rooms for emergency accommodation and as a transit hub for any of those that we need to transport through. Again, incredible work from everyone on the team. I just pass on my thanks, and again, thank you for your general compliance that's occurring out there. Into Darwin, obviously with the announcement yesterday, we are aware that there's been a lot of people that were in Katherine within that relevant period from the 7th, and as a result, Marara testing facility has been stood up today. Within an hour or so of that opening, over 600 bookings have been made, and there's already significant attendance there. Again, we ask for patience. We know it'll be a bit of a slow day getting through there, but it is important that you get that test. But equally, remember there are other places you can get your test, so go online, try and get a booking, and that might be a bit quicker than the drive-through. To RFDS and CareFlight, thank you. Your teams have been amazing in getting out on the ground and facilitating the transport of the positives and the close contacts into the Centre for National Resilience. The Centre for National Resilience team continues to balance all of their tasks, and they're doing an extremely well job in all of those trying times and constant shifting sands. But feedback from the CNR is that those who are currently housed there are actively engaged with the teams, and there's a pretty good bounce in the place as it relates to understanding why everyone's there and that it's for the safety of the territory. So all in all, the genie is certainly not back in the bottle just yet. No time to pop the corks, so please stay vigilant in your tasks, help us to help you, and hopefully we have some better news even tomorrow. Thank you.
Commissioner,
Tom?
are you aware of any, religious leaders who are unvaccinated but still providing services in Darwin or across the territory at this stage?
We were made aware that certainly at the Greek Orthodox Church there was a congregation that gathered there on Sunday. We've made some inquiries as it relates to that. As a result of that undertaking, we understand communion wasn't provided, that there was some attempt at separation, but unfortunately that's going to be in breach of the double vaccination mandate that's in place. Commander Danny Bacon is currently engaging with the church. We know the Archbishop of the diocese is supportive of vaccinations and the like, so we'll continue to work with the Greek Orthodox Church. I'm a Territory boy, born and bred. Greek community members of the Northern Territory are an integral part of our community, and we really want to be working alongside them, and I'm looking forward for a positive resolution in that space.
How are police enforcing the mandate?
Well, certainly we've been very fortunate in so much as we're not having significant overwhelming calls as it relates to unvaccinated people turning up to workplaces. So that message has clearly gotten through, and I appreciate their efforts in acknowledging that they shouldn't be placing their prior employers and employees in that position. Again, the approach will be always an education first. We don't want to move to any level of heavy-handedness. However, if people continue to be recalcitrant in that space, we may be forced into an action that is inevitable.
Have police been made aware of large numbers of unvaccinated construction workers working on commercial buildings in the city?
Not to that full extent, but we understand that there is some provisions there as it relates to building sites. But if we become aware of any actual direct breach of the show directions and the mandate in particular, then we follow that up as a matter of course. So if you are aware of those things, more than happy for you to provide that information formally post this conference.
What do you mean by provisions in place?
So as it relates to some of the construction, my understanding is that there are some provisions for them in that space, but again, if they're in breach of the specific wording in the show direction, then we will take action in that space where they're community facing and engaged.
Do you mean provisions that unvaccinated construction workers can attend the construction site?
I can double check with the show as it relates, or the chief.
My understanding, and I'll pass to the CHO as well, is that our direction is not sectoral, it's principles. So we haven't banned construction workers, if that makes sense, or teachers or nurses about the 3 tests. So there may be a workplace, and use construction example, there may be a workplace that's a construction site where someone could attend that site and not breach the 3 rules, but I'm not aware of a sector-led exemption, if that makes sense, but I'll pass to the CHO to confirm. My understanding is it's principles-based.
Yes, I just repeat what the Chief Minister has said. There are no particular businesses that have exemptions. I think that's perhaps what the question is, and that is clearly not the case.
Katherine, can I just ask, on the Robinson River situation, it is a high-vax community. What do you think the situation would look like there at the moment if we didn't have a vaccine, or if the vaccination rate was as low as we're seeing in some of those other communities?
Yes, well, undoubtedly, that high vaccination rate is a protection to that community. We may be actually seeing some of that benefit in we know that half of those were double of all of the cases that we've had. About 9 out of the 19 were fully vaccinated. We're probably benefiting from that. Certainly they're benefiting from that in terms of how ill they might get. I should have mentioned yesterday that the lady that's in hospital has had 1 dose of vaccine, and that's probably protecting her as well. So I think if we hadn't, in answer to your question, if we hadn't had that level of vaccination, we may be looking at something quite different.
Can we get a condition update on that lady in hospital?
Yes, she's stable, but she's still requiring oxygen. So she's being closely monitored.
There were calls for greater testing in Tennant Creek. Has the testing numbers improved there yesterday?
Tennant Creek, I don't know this situation, but as the Chief has said, we've had an enormous uptick in our vaccination rates. I have to say, I feel we've turned the corner. I feel that people really understand, and we're getting communication from the archos about this. People really understand that this is the way. You have to get vaccinated to be protected. So I'm very pleased about that. There are still communities where the rates are low. We can only repeat the request to please come forward. But there's an enormous effort going on, a joint effort from the health service, by the archos, and by community leaders to get an increase in vaccination. I must say that's the one very positive thing out of this, and I'm absolutely delighted about that. It's heartwarming to see it.
We've seen in other states that contact tracing can become overwhelmed once a certain number of sites and number of daily cases is reached. Do we have any sort of theoretical maximum here in the Territory for the number of cases before contact tracing becomes overwhelmed and can't keep up?
Yes. Well, I have to say the number we are dealing with is pretty well our limit. So we are at our limit now. We've been fortunate with all of our outbreaks that we've not exceeded that limit, but we're under strain, there's no question about that. But we do have the capacity to ask for help, and we have several offers of help from Western Australia, from South Australia.
Just think an important context, because this has also come up in New South Wales and Victoria, I think, specifically. The method of contact tracing we're doing at the moment has been described as aggressive contact tracing. That's the word used in National Cabinet. I'm not sure if it's an official word, but in conversation with National Cabinet Darwin, they say the method that we're doing is called aggressive contact tracing. There is an expectation at a certain stage with caseload you go down to what they call essentially baseline contact tracing, which is one reason why I'm reinforcing the importance of checking in and having your mobile number and that available, and essentially you get advised, and that's sort of considered baseline contact tracing or partial TTIQ. We're obviously not there, we're at aggressive TTIQ, but all the Doherty modelling assumes essentially a more of a baseline TTIQ. So we're ahead of the Doherty modelling at the moment, which I think is important context. But I'm with Dr. Payne. At the moment, we can sustain aggressive contact tracing. The 24-hour that we've been given essentially by no new tests coming up is huge for making sure we get at top of the old contact tracing, or the tracing that we're at the moment. And Kirby's, again, is a good example. The people who were checking in at Kirby's were not legible in what they wrote down. And we get it, there's people with English as a second language and other issues. We need to have a bit more quality control at that check-in point. There's something we'll discuss now back out with peaks and that. So this is not, I don't want to put blame, it's not necessarily Kirby's fault or the person checking in's fault, but it's something we have to improve. If you're going to do a hard handwritten check-in, there needs to be some level of legibility to that, some kind of contact number we can have that we can trace you on. That's when you get into that baseline contact tracing.
The hospitality industry says it's taking a massive hit because of the mask mandate. Given we've got no cases in Darwin or Alice Springs, and at the moment negative wastewater in those areas, do you think there's any chance that mask mandate could be lifted before 6 p.m. Monday, as is scheduled at the moment?
Oh, you know, we'd be open to lifting prior to 6 p.m. Monday if we get some more wastewater testing that's negative, if we see a high testing rate across the Northern Territory, if we get some confidence about no spread outside the Territory. In some respects, we've got the opposite. Even though there was negative wastewater yesterday in those areas, when we gave out that request for people who have left Katherine or left Robinson River, and we saw just how many people came forward for testing. That's people who volunteered, right? So there'd be an element of people who didn't come forward yesterday. It's clearly been a lot of movement through Katherine since that 11th, and there still remains for us a territory-wide concern. We don't want to do measures we don't have to do. If we get information that comes forward that gives us confidence around lifting the mask mandate, we'll obviously lift the mask mandate. I'm sure Dr. Payne would be happy. Yeah, he's nodding. Dr. Payne's happy to agree to that. So we've got this measure in place. It's running parallel to the Katherine lockout and the Robinson River lockout now. We'll extend that one too. So it's all of us together at this stage. But if we can step the Territory back, if I get news that says the Territory is not looking like a spread scenario, happy days, we'll lift the mask mandate.
And they obviously would love that to happen before the weekend. Do you think it's the possibility that this time tomorrow you could be...
I'm very aware that probably for commercial reasons, noon tomorrow would be the Hospitality NT's preferred time. I can't make this decision on commercial reasons. I get why they're asking for that, but we would have to have the data to make the decision, and we'll make this as a data-driven decision.
Is there still a policy to move all the close contacts into Howard Springs? How many of the 280 that have been contacted so far have been moved?
It depends on the circumstances, so I might pass to Territory Controller or Dr. Payne on this one. So we moved everyone from Robinson River, obviously in. It's not necessarily the case in Katherine. It depends if there's an ability for them to do the 14 days at home in a way that's doable. So I don't think it's a mandatory close contacts into Centre for National Resilience decision. It just depends on some of the circumstances. And we've done that in the past, I think, too, that we've left some of the close contacts in their own premise. I don't know if Dr. Payne wants to confirm that. Or
No, I can confirm that.
yes, he supports that.
you must be spending a small fortune at the moment flying people in and out of Robinson River and all the other measures that are in place. Anthony Albanese, several months ago, suggested a $300 incentive to get the vaccine. Is that something you've considered here, and would we be in a better position now if we offered that incentive a while ago?
Well, I understand $300 is the amount that CLC put on the table for within their organisation. I don't know what the total vax rate in CLC is at the moment, but obviously the vax rate in Central Australia is a concern. The advice I got out of Central Australia when I went down there, and obviously the vax rate was the purpose of this visit, and I did some remote work of that, they advised that $1 incentive probably wasn't going to be what shifted the needle, and they were doing, and we've done this, it's been different across the territory in different places, but there's been some store vouchers and other things, and different communities people come forward with offers, so it hasn't been uniform, but it hasn't necessarily moved the dial on vax rates. Yeah, I'd never say no to if the Australian government's put $300 in the pot or not, but I've always been a big believer that if you're going to have a incentive, or if you're going to give people money to have been vaccinated, I'm not going to punish those who came forward early. You know, everyone has to get a benefit if they've gone and made that effort. It's probably more of a we've seen probably more of a shift on vax linked to cases, and if you look at the when we've had a case, we've had a lockout, when we've had fear in the community, people have gotten vaccinated, or when there's been a distinct direct advantage to being vaccinated, like the lockout scenario, where you can live your normal life, that's been the spike for vaccination. So I think they're the things that are more likely to drive a vax rate.
You would have seen the rates on Groote Island though, they're fairly extraordinary, and there have been incentives offered there.
But there are communities that have a similar rate to Groote Island without that incentive.
Are we still on track for the quarantine start next week?
Yeah, so we're all the pilot. All the results out of the pilot, all the testing results out of the pilot are negative, if that makes sense. So the pilot's working, we've had no dramas of breaches or anything like that out of the pilot. The issue we currently have is someone who didn't go through quarantine in the first cluster, and if obviously cluster 1 is linked to cluster 2, it's the same scenario with someone who avoided the quarantine system is why we've got the current caseload. So at the moment, all the demonstrations on the home quarantine or the quarantine system have been positive.
Within the Parliament school in Katherine, the number of close contacts yesterday was at 3, and now it's climbed to something like 30. Is there
38.
any particular reason why that's happened?
It's the tracing work. So I'm not sure this is true of the McFarlane close contact. So this is a generic comment on the tracing. We're dealing with a lot of people with English as a second language or other things. So completely cooperative tracing efforts, but it's taking some time to get the exact right information, corroborate it and work it through. So it is a more complicated tracing situation maybe than some of our previous tracing efforts. I understand we've got interpreters involved and all that sort of stuff, so we're no complaints there. It's just taken a bit more time than it might normally take to do some of the tracing work. And talking to the tutor who was at McFarlane Primary School and tracing through what was happening on the different on her time in the school, we've been able to identify those close contacts. So simply just time taken and doing the tracing, nothing else.
There's a lot of mixed messaging. Cases got changed immediately after yesterday's press conference. You said anyone leaving Katherine had to isolate until a negative test result, but NT Health sent out differing information. Who are we meant to be listening to?
So yesterday we gave 19 as the overall case number, and that was accurate, but we should have said 8 cases overnight instead of 6. So I'll take that. That was my opener. But we gave the accurate overall case number, and obviously the two that the other 2 were in Siena. The advice yesterday about the isolate and get tested was accurate when we gave it. As we say, things can change. It became obvious really immediately how many people had left Katherine and the unintended consequences of that direction. So the CHO made, I think, a very wise decision to differentiate on vax status. So that was an update to the decision that we gave at the press conference. So things will change, and we'll provide the updated information as things change. Unfortunately, during COVID, they can't stay set in stone. And I genuinely believe it was very sensible to differentiate on vax status.
A few questions to the Party Controller. Just on the rough sleepers in Katherine, you said you engaged about 30...
51?
Yeah. Do you have an estimate of how many rough sleepers are in total?
So the feedback I've got is that they've engaged pretty much that large group. They went to 13 known sites around the place. There would undoubtedly be some others. They're continuing to work through those groups today. We've sent additional resources down from the welfare group to also go and support the not-for-profits on the ground. So I'd be very comfortable that with the activity that's been gone on the ground, they would have been able to make contact with everybody that's there.
And do you think the 50 there, how many of those beds have been taken up so far? Is there any information on that?
Again, not many of those beds have been taken up. People know that there's accommodation offers available, but they're choosing to sleep rough. But again, as I spoke about yesterday, many of these people are comfortable in that environment. They're aware of the provisions more broadly around wearing the mask and trying to maintain the physical distance. And it's probably an unfortunate reality of homelessness is that a number of them choose that solitude and prefer that lifestyle.
Chief, just on the Greek Orthodox Church, the Commission talked about that, but just your comments on obviously hearing that a service went ahead on Sunday in breach of the Federation.
First, can I say that the Greek community have been magnificent. This, I believe, is in some respects an isolated part of the Greek community or a smaller part of the Greek community. Overall, the Greek community have been fantastic. We are looking for leadership when it comes to things like vaccination. For all our leaders, whether you're a TO or a politician or the police commissioner or a faith leader, and it goes on. We need leadership from all parts of the community to drive vax. It does concern me when you have a leader in the community who's not driving vaccination rates. I think we've been public about that concern. The Archbishop of the Greek Orthodox Church is extremely supportive of vaccination and pro-vax. We want everyone to abide by our direction, so the Chief Health Officer is giving a very sensible direction around vaccinations that's there to protect the vulnerable. There are a lot of yayas and papus that go to the Greek Orthodox Church. We've got to make sure we look after them. We know how vulnerable our old people can be, or our senior citizens can be, to coronavirus. So we've got to be very careful about how we work with our community and don't expose anyone unnecessarily to the virus. As I understand it from the Commissioner who's been leading the enforcement work, education first enforcement work, there was an attempt to abide by the direction in terms of how they managed the service, which didn't abide by the direction. So that, not good enough, and we have to do better. And we have this in place, not to punish people, but to protect people. We'll work our way through that, but really we need leadership from all parts of our community to keep the vax rate up. It can't be me here at a press conference that drives our vax rates up. I've been saying it for a long time. We've got lots of high vax rate all over the place, but if you look at where we have got pockets of low vaccination rates, that is going to require a persuasion effort on the ground in that community. So whether it's a pocket of the Greek community, it's going to require leadership within that Greek community, probably from another faith leader or strong people within that community. If you're talking about remote Aboriginal community, they've heard it from me for a long time. they've heard from our VAX teams. We've made regular visits to that remote community. It's probably going to require some other additional voices in that space, and we've been doing that work. We've had people go into these communities that aren't me, that aren't a VAX team, to do that. So we are making these efforts, but it requires leadership from across the board to see those VAX rates go up. So I know that within the Greek community, the majority of people are extremely supportive, understand the need to protect others, understand the importance of vaccinations. And this is not a comment on the Greek community. It's just a comment on an element of parishioners who, unfortunately, at the moment, are not buying into the vaccination efforts.
What do you
Thank
think about private businesses who continue to flout the mandate? What are you going to do about that?
So obviously, enforcement's done through the Police Commissioner or Environmental Health Officers. We need people to abide by the direction. There will be visits out to businesses, as we've done spot checks of all the different COVID plans over the last 18 months. We need to see people abide by that direction. If you're not abiding, it's a $5,000 fine for an individual or $25,000 fine for a business. If you don't follow directions, then police can step up beyond a $25,000 fine if necessary, but we also need to see people abide. There's probably been no better example than this week about the importance of abiding by the CHO direction. If you look at the exposure sites in Katherine, some of them are sites that exist. This mandate exists principally for these sites, so we can guarantee the continuation of health service delivery, for example. You don't know who's going to go into your premise. In a lockdown decision, as we got in Katherine, we can't prevent unvaccinated people going to Woolworths. People need food. They need to go buy, shop, eat. So we need everyone in Woolworths to be vaccinated. We've seen a reduced trading hours of Woolworths Katherine at the moment to abide by the testing decisions and other things that have occurred. If they're double vaccinated, the ability to make sure we maintain that service remains high. We don't want to have to do mandates. We don't want to have to do lockdowns. We don't have to ask people to wear masks or do any of this stuff. We're doing it to save a life. We're doing it to save a job. If we have a vaccinated workforce, A, you're safer, and B, you're more likely to be able to stay open. These are just very practical decisions we're trying to make to keep the territory as a functioning place. Thank you all.